Have you ever wondered why chronic pain is so difficult to heal? And if you're watching this video, I'm guessing that you're one of those people. So you're wondering, why is this so hard? And why are the treatments and other therapies I've tried not very effective or not effective at all? I hope to answer some of those questions and also introduce you to a concept that can help you with your challenge, which is called pendulation. Hi, I'm Michael Westgate. Thank you for joining me. I've helped people with chronic pain for over 2 decades. I aim to help you say goodbye to pain and hello to a fully lived life. Pendulation is a term coined by Dr. Peter Levine, who is the creator of Somatic Experiencing therapy, which is a therapy for trauma and chronic conditions. So let's talk about how this plays out, and then we're going to talk more about what pendulation is, and then we're going to practice it together. So pain without a physical cause. So someone like you will say, I hurt and, I've been hurting for years, or maybe I've been hurting for 3 months and it won't go away. And what they tend to do is they'll look at your physical numbers, your blood tests, x-rays, MRIs, and they don't find anything. Oh, whoops, right? So now what? Well, they basically will tell you, I don't know what to do, send you somewhere else, or insinuate that it's in your head and that you're maybe faking it in some way. And what's really happening here is they're overlooking, they're not seeing the emotional aspects of chronic illness. So the traditional medical approaches tend to ignore that, and they say if it's not logical, then it can't be true. And emotions aren't really considered. And your personal report of your feelings, thoughts, and struggles are not usually considered as a medical measurement of any kind. And that's a problem because the trauma-pain connection is not understood in this case. Now, what they're overlooking is you have traumatic experiences, which is overwhelm. Because trauma is an overused term now, and I still use it, but it's problematic because, these days people say, I'm traumatized because I didn't get the right coffee at Starbucks. That's not the same thing. I'm talking about a situation where you feel like you have no control, and that whatever is being done to you or not done to you is overwhelming because it's so important to your well-being. For example, like a child. So if a child doesn't get fed or loved, like affection and attention, or if a child is beaten unfairly and abused verbally, for example, that would be an example of trauma. Also, physical injuries, war, so on. So the overlooked aspect of pain management is the relationship between unresolved traumatic experiences and the pain and illness that is manifesting in your body, right? So the key to effective treatment is to recognize that trauma has a huge impact on the likelihood of your disease or your struggle, and that it has to be addressed if you're going to fully recover from this challenge that you're going up against. What happens is the trauma has a physical imprint, and it manifests in the body in all kinds of ways. What happens is you have an experience that was overwhelming at the time that you experienced it. You did not have the resources to face it and process it properly, and therefore it is running through your body. Oh, it has a cycle of its own, like a life of its own, where it runs through your body, kind of cycling through, looking for a resolution. And when it doesn't find the resolution, it manifests as different symptoms like headaches, stomach ache, joint pain. It could be random, like it could be hand pain. It could be eye pain. And sometimes that has to do with the sort of experience that you had. But it's not that's not even that important. The important part is to recognize that when you have experiences that you could not fully process at the time, they will continue to haunt you in the form of body sensation, intense feelings, or even numbness, because they continue to want to come to resolution, and they'll keep coming up. In other words, it's saying, here, I'm still here. I still need your attention. But if you still don't have resources, you can't face it. So here's the kind of endless loop of trauma-induced illness, is that you don't have the resources to face it, so you suppress it, and then because it's suppressed, it bugs you with pain. So how do you address this? Well, that's what we're going to talk about today. But the nervous system is the key. So here's how it works. Most of your decisions are made by your body. And that's a really new concept that neuroscience has brought forth, including polyvagal theory, which is what I've studied very thoroughly. And here's what it does. Your body decides for you how safe you are or not in your environment. And then it cues your emotions, your thoughts, and your body chemistry to act in that way. So if your body is not feeling safe because it has been, you have been mistreated unfairly over time, and it could be not just your childhood, but even past that, then it will decide that you're never safe. And then it will respond in that way where you're always in a primitive survival response rather than going back to places of ease and healing. So you're basically stuck in protective responses ongoing. And that's a problem because that being stuck in protective responses also increases your level of inflammation in your body. And excess inflammation is the driver of almost every chronic illness that we know in the modern world. And you have to understand that the pain is a survival signal. So it's a warning. If you're not getting the warning signal properly, in other words, you don't understand it because it's ancient, it's from your past, so to speak, it's from years ago, then you will continue to hurt. And what that goes into the category of is maladapted patterns. And what that means in plain English is that you are responding to your life in a way that makes your pain and your life worse, not better. And here's a good example. If you were to fall in the water, like off a boat, and you didn't mean to, is that a good time to go to sleep? I hope not. It would not be a good time to go to sleep. That'd be a time to be super active, right? So you're going to respond to that. You're going to swim. You're going to look for, waves of the boat. You're going to try to get back on. Or if a bus is coming at you at high speed in the crosswalk and the bus driver doesn't see you, I would hope that you do not become friendly with the bus. Instead, that you subconsciously dive out of the way, right? So that's an action response. And, there's other times when you have a situation where someone's maybe being very aggressive, but they're way bigger than you. So that might be a better time to act harmless. And that's what shutdown is. When there's a place you go in your body when you're overwhelmed, you're overpowered, and that the best strategy is to actually, what they say, play dead. So actually act harmless. Because it's built into our nervous system, it often does work, and that's why it's there. So the solution is to befriend your body and the body sensations instead of make them wrong, argue with them, and try to run away from them. In the somatic experiencing and the pendulation, you are guided to focus on your body in a way that allows you to trust it and come to work with it rather than just dismiss it, which is usually what happens, especially in Western societies. And you want to start with areas of your life that are not painful, and it could be both body areas and just memories, and then use that as a resource to help you change the pattern in your body. I want to look at a chart right now so that I can explain visually how that works. This is my polyvagal chart, and what we want to do here is, rather than being stuck on the right side of the chart, so this is danger or life threat, and when you're in a kind of a downward spiral in the nervous system, what happens is that it gets stuck on this right side of this chart where the responses are only in these primitive stages of response. So you don't have the choice to be safe and relaxed socially or creative or in deep healing places. That's what intimacy is. Instead, you're stuck over here where you don't have a choice. And what we really want is for you to have full range. So all these states that are listed, these are states of response, are necessary for different situations and are say even ideal. And what you really want is to start, if you have trouble getting out of these, is to start dipping over to safety. And this is remember the pendulation? It's an oscillation. It's going back and forth, back and forth. And, right now, maybe you can't do that. Maybe you can just touch on the edge of it. But with practice, you'll be able to dip over here and then come back. And that will give you the resources necessary to work your way out of traumatic activation. And if we look at this little chart here, you'll say that when you're doing well, the nervous system has this wave pattern of action and rest, action, rest, action, rest. And it's nice and smooth. So it's even like sleep, wake, sleep, wake, sleep, wake. And then if something gets kind of dangerous a little bit, then you're going to dip more into the sympathetic energy, which is action. But then if it gets too overwhelming, you get into the spiky stage here where your nervous system can't do that wave pattern. It does a spiky, sort of jerky activation of different survival things. So here you're frozen. That's what this is. And then you're depressed. But then from depression, you go to horrible anger. And then from horrible anger, you go back into depression. And this is a likely pattern that you may relate to. Now, you may be someone that's mostly depressed, which means that you would just be stuck here. And what you want when you're doing sort of the healing vortex is you want to encourage this rhythmical dipping into the safety and back to the danger appropriately. And instead of being stuck on just one side over here. So, and by the way, you wouldn't want to be just in safety either, because if something dangerous comes along, you want to be able to face it appropriately. So this is the foundation for trauma work, is to establish this positive calm in yourself that allows you to resource properly and be able to handle these overwhelming experiences without running away from them or trying to cover them up. So let's just talk a little bit more about Peter Levine, that he created a system called Somatic Experiencing, and he also came up with the concept of pendulation. What the pendulation is a natural rhythm that is innate to health, right? So you want a rhythm that brings you back and forth from being challenged to being relaxed and safe. And to give you an example, is that if you look at a child with her mother, you'll notice that here's what a healthy dynamic is. The child, as they grow up, gets more and more brave about getting further and further from their mom, which is the source of safety and regulation. And as you know, hopefully, by the time they become a young adult, they actually really kind of go away. Like they go to college and they maybe move into their own place, and maybe they get married and have a family. So that's really moving further and further away from that sense of resource from mom. And then that pattern is then reflected throughout their lives. But if you didn't have that base, now you're kind of in trouble, because you don't have that experience of going from a safe place to a dangerous place and back to safe. And when you do that rhythm in a good way, what happens is that dangerous thing becomes not dangerous anymore, or you can handle it. Where if you didn't learn to do that, then you don't know how to handle things properly, and you just get very stressed. And the other important part is that if you don't have that rhythm in your system of knowing how to go towards a challenge and come back to a place of safety, you can't properly process your feelings and your emotions. So they get stuck in your body, and they keep, like I said, they keep bouncing around and causing trouble. In somatic experiencing therapy and things like it, the pendulation involves these gentle swings back and forth between feeling threatened, feeling resourced and safe. And you got to start small, because your range isn't very big, and then you gradually expand. But you basically, again, what you're doing is you're going from distress to resources, distress to resources. And so the gradual release is what safely allows you to get better. So you want to avoid overwhelm. And this is a problem often with people with chronic illness, is that they're so used to just charging into life, partly because they didn't have any choice, that they often don't rest enough. They often don't eat regularly. They don't sleep regularly. And everything's kind of that spike pattern that I showed you before, because they haven't established this rhythm of activation and recovery in their nervous system. And the nervous system, again, is the thing that's driving decisions. So you can see how messy that would be, right? You start out, the rhythm is not established, or it's shattered by an experience. So you might start out okay, but then you go to war, or you have some other experience that shatters that sort of rhythm of rest and recovery. And now you have that spiky pattern where you just jump from one defensive or attacking posture to another, instead of going back to that place of ease. So let's break down the concept a little bit more, and I'll put a little more detail on here. So first of all, you have to learn how to identify survival responses within your body. So you have to know how to focus on body sensations, to reconnect with those unresolved memories, because they're in your body and in a form of sensations. And it would be things like tension or discomfort in the body. Just think about yourself right now. What is it, your kind of chronic pattern of discomfort? For me, it's like tension in my neck and jaw. And let's see, those are in the upper back and neck. Other people might be your stomach. Other people might be something else like your hip. It doesn't really matter. And then you have this phase of contraction, right? Once you recognize that challenging thought or feeling, you're going to go, you're going to kind of try to withdraw from it because it's intense and it's overwhelming. And so you have a heightened awareness of that sensation, of what your body's feeling, and it will often increase the volume of that sensation once you focus on it. But don't worry. Now you have to shift to resources. So you're getting that build up. You're going towards overwhelm. It may not take very long because you haven't dealt with it before. And you want to transition your focus from that intense, overwhelming thought or feeling to a place in your body that isn't threatened. So there's always going to be some place in your body that doesn't feel threatened that you can focus to. And then as you do that, you're going to spend time with that place that feels safer. And that's the expansion phase. And this leads to feelings of safety and relaxation, if only a little, right? So at first it may not be much, but it's going to be a little. And it provides a break for the nervous system from that intense, overwhelming thing that tends to push you over into survival strategies. And then as we alternate between these two, so contraction, trauma focus, expansion, resource focus. So contraction is trauma focus, expansion is resource focus, and that is establishing a natural flow back into the nervous system, but gradually. It's not going to happen all at once. So this back and forth movement facilitates this natural rhythm that will gradually help the nervous system process the experiences effectively so that they don't keep coming back. And it reduces the intensity of the trauma response over time and therefore releases all that trapped energy in your body. Because when you have an experience that's not fully processed, what happens is that there's all this energy used in your nervous system to suppress it, to like cage it up. Once you release that, you have all this extra energy for other activities, other things to focus on, other movement forward in your life. And therefore, it enhances your own ability to regulate your own emotions. And you're going to achieve a better sense of yourself, a better sense of balance in your body, and it's going to really aid in this process of getting better. And the ultimate result is resilience. So if you want resilience, this is one of the ways that you can build it, because you're starting to fortify that muscle. So the vagus nerve is involved in this, and I've talked about that in another video, which I highly recommend watching. The vagus nerve, why is it so important to your health is what I talk about in that video. But what we're talking about here is the message that's sent through it determines what your body does. And we want to have more of that sort of relaxed, at ease state available to you so that throughout your life you can recover from stress. The other thing that's amazing is that if you do this enough, if you get re-traumatized, so in other words, you go through another overwhelming experience that kind of takes you out, you are going to be able to recover from that much quicker because the nervous system has this new pathway that it can follow and these resources that you've practiced over time. So in conclusion, Pendulation serves as a model for overcoming chronic stress-related conditions that you are struggling with, including things like depression, anxiety, PTSD, and even autoimmune disease. So it's not just about the chronic, migraines or the chronic back pain. It's about all these conditions where people suffer ongoing from them. And the model shows us how to successfully resolve these cycles. And I said there was a cycle, a downward spiral of distress and illness that tends to reinforce itself. And if you can start pushing yourself just little by little bits over to the other side more often, then you will have more resources for the body to heal. And the resources include, it's not just positive kind of non-painful body areas, it's also positive memories and even your environment around you. Part of knowing how to do this isn't just body and memories. It's also recognizing over time, wait a minute, when I'm in the park, I feel relaxed. But when I'm at work, I feel stressed. Okay. Well, maybe then if every day you went to the park after work, then maybe eventually work would become more manageable, right? This is an idea of how you can apply this kind of broadly. Or you can say, when I'm with my buddies playing basketball, I feel relaxed, I don't think about my problems, and I'm happy. But when I'm at school studying for finals, I feel stressed. So there, again, you can have this pendulation between those two things as a potential practice to help regulate yourself. And what the model is really showing us is what I call the necessary ingredients for a practice to actually help you. Is you need a practice to bring you from one extreme to another, and that would include things like Wim Hof breath work, cold exposure. I do both those. It could be meditation versus, so mindfulness meditation where you're focused on sensations, in contrast with a more broad sort of contemplative practice about like loving kindness. The loving kindness is where you wish everyone, yourself and everyone else well, and it gets very expansive. You go from just focusing on yourself to focusing on the world. And so remember that one of the main drivers of illness is a nervous system that does not respond to its environment effectively. So in other words, the rhythm is off balance. And you want to bring those rhythms back into optimal alignment as best you can, because those rhythms are actually almost like habits in the nervous system of response. And therefore, if you have a good habit of response to sleep, for example, when you get close to sleeping, you'll start calming down. But if you're like many people with chronic illness, the closer you get to sleep time, the more agitated you get. That's not great, is it? Because then you avoid sleep, you do stupid things that you regret later, like binging on zombie movies or something, and that's not good. I mean, what you want is when sleep gets close, you have this sense of warmth in your body, this ease, this looking forward to being cozy. That's what you would want instead of what you likely have now, which is an avoidance pattern. See, and here's the other principle I want you to remember is do not let yourself become too overwhelmed when you're facing your unresolved experiences. So you can't do this fast. Please throw away the Hollywood version of this, which is, in Hollywood, everything gets resolved in like one scene in the last 5 minutes. That's not how it works. Most healing from traumatic stress is a gradual process. And the reason it's gradual is because if you try to take on too much of that at once, you try to face too much of it at once, it's just going to crush you. So instead, you want to face it with kind of an attitude towards yourself is that you're someone that you really care about, someone that you're concerned with, someone that you want to help. And if you did that with your best friend, you wouldn't say to them, look, you got to hurry up, man. Enough of this trauma stuff. Let's just get over it. I mean, that doesn't work, but that's what you do to yourself, isn't it? So instead, you want to say, I'm my best friend, and I want to help me get better. And so therefore, I'm going to be patient with myself and not make myself wrong when I don't get well in 3 minutes when I do the exercise the first time, right? You want to have patience, and you have to practice over time. So the ultimate goal of effective treatment for escaping from chronic illness and chronic pain is a nervous system that has a larger range of responses. So you want to be a person that can respond to a multiple of experiences and challenges without going into that overwhelmed place where you become shut down, frozen, angry, avoidant, difficult socially, on and on and on. You have your own version of that. And also to remind you, it's very likely that if you've been in pain a long time, that what you really want, or you think you want, is to be safe and relaxed all the time, happy all the time. And I want to correct that because that is not a healthy nervous system. That is a fantasy. What you want is to be happy when it's appropriate. What you want is to be sad when it's appropriate and angry when it's appropriate, instead of always one way. You don't want to be always defensive or attacking. You don't want to be always positive and helpful, because sometimes being positive and helpful gets you in trouble, as you may have experienced already. I certainly have myself. So that's what your goal here is an adaptive range of responses to your life so you can be more empowered, and so you don't get unnecessarily stressed when certain situations arise. All right? So next we're going to practice together. As a reminder, I want to remind you that when your body is overwhelmed or in pain, that you and we all tend to disconnect from it because we see the body as the source of pain. And therefore we reject it and we abandon it because we want to get away from the pain. So the exercises that we're going to go through right now, we're going to do 3, are to help you reclaim your connection with your body. And what we're going to start with is what's called a box breath. And it's the box breath is meant to calm down your system. That's why we're starting with it, so that you could be more successful with connecting with your body without running away from it. So it's a powerful technique for calming the mind and reducing stress and enhancing focus. And the reason it's called the box breath is because it has 4 stages of practice, which forms kind of a box shape, so to speak, in the practice itself. And you'll see how that goes in a sec here. So to start, find a comfortable position. Begin by finding a quiet and comfortable place to sit or lay down. If you're sitting, sit with your back straight and place your hands on your lap or knees. Close your eyes if it helps you concentrate, or you can keep them open with a soft gaze. Inhale slowly. Count to 4. Start by taking a slow, deep breath in through your nose. As you inhale, count silently to 4 in your mind. Imagine filling your lungs with air, allowing your abdomen to rise gently. Next, hold your breath for a count of 4. Once you complete the inhalation, hold your breath for a count of 4. Keep your lungs comfortably filled. Maintain a sense of calm during this phase. Exhale slowly. Now begin to exhale slowly and steadily through your nose or mouth. As you exhale, count silently to 4. Feel the tension leaving your body with each out-breath. After you empty the lungs, hold your breath again for a count of 4. During this pause, you'll experience a moment of stillness before the next inhalation. Repeat the entire cycle for several rounds. Inhale for a count of 4, hold for a count of 4, exhale for a count of 4, and hold for a count of 4. Continue this rhythmical breathing pattern. You want to maintain your awareness as you practice. Maintain awareness of your breath and the sensations in your body. If your mind wanders, gently bring it back. Focus on your breath and the counting. You can choose the duration of your practice based on your needs. Start with 3 to 5 minutes and gradually extend the practice as you become more comfortable with it. Finish mindfully. When you're ready to conclude the practice, take a few natural breaths and open your eyes if they were closed. Notice how you feel after the box breath exercise. The box breath exercise is a simple and effective way to calm your mind, reduce stress, and enhance your overall sense of well-being. And it can be used as a quick reset during a busy day or as a part of your daily routine. I recommend that you practice it regularly to build up your resilience to stress and to prepare you for any sort of event like presentation or test where you feel like you're too stressed out and you may not perform well. All right, so now that we've done the box breath to prepare ourselves, now we're going to do a pendulation exercise to relieve pain. So here's the preparation. Again, you want to find a quiet space. You want an environment where you won't be disturbed. So if in all these exercises, it's best to let everyone know not to come bursting into the room. If you have pets, please put them out of the room so they don't interrupt you. Unless you need them to feel regulated, in that case, it's fine. But generally speaking, it's better if you're on your own. If you have someone else in the room to help you feel secure, just make sure that there's no talking or interruption for your practice. So you want to comfortably sit or lie down and allow your body to relax. So if you're in a chair, just kind of sink into the chair. And if you're in a bed or on a mat, then let yourself just kind of sink into the mat. We're going to start by exploring sensations in the body. Begin by focusing on your breath. Take a few deep breaths to center yourself and bring your attention to the present moment. Then scan your body. Explore your body for areas of comfort and ease. So those are areas that feel warm, at ease, and happy, relaxed. And then explore your body for areas of discomfort or pain. And the sensations in both of these cases could be quite varied. So for pain, it could be a sharp, it could be hot or too cold or tense and gripped. Doesn't really matter as long as it's something that you feel uncomfortable with. And just note the areas in your body that feel uncomfortable and the ones that feel comfortable. It's important to pay attention to the qualities of the sensation in both of these because it helps your nervous system when you can name it. So you might even say to yourself, this area of my body feels numb. This other area of my body feels prickly or throbbing. And then likewise, you go, this area of my body feels light, or it's floating or warm. See if you can do that. You're going to see if you can label both areas of comfort and ease and areas of discomfort or pain. Now, what I want you to do is lightly assess the intensity of discomfort or pain on a 1 to 10 scale, and 10 being the most intense. Now that you've identified some areas, I want you to choose an area of discomfort or pain that is moderate in intensity. So do not choose the one that's the worst. Choose one that is in the middle ground. You're going to use this when we do the pendulation exercise. So now direct your attention to the chosen area of discomfort or pain and observe it without judgment. Pay attention to the qualities of the sensation. Is it sharp, dull, throbbing, or burning? Describe it to yourself. Keep breathing. Continue to breathe slowly and deeply. Avoid holding your breath, even if the sensation is intense, and don't force it. Now, when the sensation becomes overwhelming or too intense, redirect your attention to the area of comfort that you identified earlier. It could be any of them. It could even be a neutral area, as long as it's an area that isn't in distress. As you shift your focus to comfort, notice how the sensations of your body change. And again, do your best to name specifically what that area feels like. It's warm, it's relaxed, or you can even say it's neutral, so it's just kind of quiet. Now that you've spent a little bit of time with the positive sensations, practice moving back and forth between the contraction of painful area sensations and expansion, the comforting area, and their sensations. You have to trust the rhythm. Allow this kind of oscillation, this pendulation, to kind of proceed naturally. Trust your body's innate sense of when to move between the different areas. As you observe this pendulation between the two areas, notice any changes in the intensity or qualities of the painful sensations. The pain may begin to soften as you shift back and forth. So keep practicing. You're going to go at your own pace. Spend as much time as necessary in the at ease area so that when you come back to the place of pain, that you feel like you have more grounding and more resources. So as you pendulate, you're facilitating the gradual release of trapped energy and emotional tension associated with that pain. And remember that over time, you may achieve a better sense of balance and regulation in your body, which will aid your healing if you do this regularly. All right. Now, I want you to come back to the sensation of ease and sit with that. So just sit with the sensation of ease and kind of try to go deeper into that space. And then go back to the place of pain and see if it feels any different than it did when you started. And if so, see if you can name it. It used to feel prickly, now it feels just achy. Or maybe it's slightly numb, but there's no prickle. Or maybe it's even warm now and a little more at ease. Whatever is real for you. Then, following your breath, if you've closed your eyes, slowly open them and kind of feel yourself in your chair. Reorient to the space you're in when it's appropriate for you to do so. All right, so this exercise will build resilience in your nervous system. And I want you to consider incorporating pendulation into your self-care routine to strengthen your nervous system and to up the capacity to handle difficult emotions and painful situations. What's extremely important to this process is self-compassion and patience. Healing is a journey. It's okay that it takes time. And this is a great thing to use when you feel overwhelmed by a circumstance or some sort of event. If you can find some quiet time, you can lock yourself in the broom closet for 10 minutes. This would be a great place to go to help you with that overwhelm. All right, so next we're going to do a similar exercise, but this time we're going to pendulate or oscillate between happy and distressing memories to help with emotional regulation. So it's the same principle. And one of the reasons why I'm putting these together is I want to show you that the principle of pendulation can be used in many different practices as long as you understand the basics. So this practice aims to help you navigate distressing memories by creating a balanced rhythm between these distressing memories and happy, soothing memories. It's a gentle approach to emotional processing that prevents overwhelm and promotes more emotional regulation for you. So again, make sure you're in a quiet space. Choose a quiet and comfortable place where you won't be interrupted. Ensure that you're in a relaxed position, whether sitting or lying down. First, recall a soothing memory. Begin by thinking of a time when you felt completely at ease in your body. It could be a situation like one of these: walking in nature, lying on a beach, sipping tea and reading your favorite book, or maybe it's spending time with friends or loved ones. So find one of those memories that you cherish and that when you think of it, you feel your body respond by relaxing. Close your eyes and immerse yourself in this memory. Pay attention to the sensory details, such as sight, sound, smell, and physical sensations associated with this soothing experience. Embrace the memory. Allow yourself to fully embrace the soothing memory. Feel the positive emotions associated with it, whether it's joy, contentment, or relaxation. Let these emotions wash over you. Now, transition to a distressing memory. Gently shift your focus to a distressing memory or the thing in your life that is currently causing you stress. It's important not to rush this transition. Take your time and be mindful of how it feels to shift from a soothing memory to a distressing one. Now explore the distressing memory and pay attention to your body's sensations in response to it. So as you focus on the distressing memory, pay attention to the emotions and physical sensations it evokes. Notice any tension, discomfort, or emotional response that arises. It's okay to experience these feelings. The key is to avoid becoming overwhelmed. As soon as you start feeling overwhelmed by the distressing memory, switch your focus back to the soothing memory you recalled in the second step. This is your safe haven, a place of comfort and calm. Return to the soothing memory with the same level of immersion as before. Reconnect with the positive emotions and sensations associated with it. Allow these feelings to wash over you once more. And continue to pendulate. So you're going to repeat this process at your own pace. Keep pendulating. That means oscillating between the distressing memory and the soothing memory. The goal is not to erase or deny the distressing memory, but to regulate your emotional response to it. Gradually, you may find that the distressing memory becomes less overwhelming. So now bring yourself back to the positive memory and rest in that space just for a few moments. And now just touch base on the distressing thought or feeling or memory and see if it's any less intense than it was before you started the exercise. Just keep that in, just note that and see if it, and by the way, if it's not that much different, it's fine. But it's often that it will feel less intense after this exercise. And then gradually bring yourself out of the practice and open your eyes and reorient to your surroundings. So now after you've done this process, after you've practiced pendulation, take a moment to reflect on your emotions and experiences in the practice. And also practice self-compassion. Acknowledge that it's okay to feel distressed. There's nothing wrong that you feel distressed and overwhelmed. It's not a failure. And remember, this practice is about creating a balance and a safe place for processing these difficult feelings or emotions that you are challenged with. And remember that pendulating between happy and soothing memories is valuable self-care for emotional regulation. And over time, if you practice the things that these three practices that I've just shown you, it can help you build resilience and a more balanced relationship with challenging memories and emotions and body sensations, which over time will help steer your health towards more emotional, more regulation, more ease, and more ability to heal from distressing and difficult present and past situations. So in conclusion, pendulating between soothing and distressing memories or body sensations is a valuable self-care practice that will help with your regulation of stress. And over time, it can help you build resilience and a more balanced relationship with your body and the sensations that your memories and unresolved issues. So I highly recommend doing these practices regularly. Daily would be best till you discover that you can more spontaneously apply them in your life when distressing things show up. If you found this content helpful, please like and subscribe. Click on the bell so you won't miss my next video. For more in-depth articles and videos, visit my website at michaelwestgate.com.